Hello there! My name is Jane, and I love to eat nuggets, sausages, and burgers. I enjoy trying out new products from each fast food chain. But something strange happened to me a few weeks ago. I realized how difficult it was for me to poop. I took a long time in the toilet. I told my mom, and she realized that I am having constipation. Later that day, I bought medicine from the pharmacy to help me pass the stool. Voila! It works for me. Now, I practice to eat less processed food and more fruits and vegetables to make sure I will not experience constipation anymore. Today, my friends, I am going to tell you a story about constipation. I believe we've all experienced constipation at some point in our life, so let's get started. We go to the toilet every day to get rid of waste from our bodies. Some of us, however, may find it difficult to poop. Constipation occurs when our bowel movements become less frequent and the stools become difficult to pass. These conditions has the potential to interrupt with our daily tasks. So, how to know if you are having constipation? Don't worry, I got you. These are the symptoms of constipation. Firstly, you pass stool less than 3 times per week. Next, you have difficulty and pain passing stools, and the stools are dry, hard, and lumpy. You will also feel bloated, stomach ache and cramps, and feeling nauseous. Last but not least, you need help to pass the stool, such as pressing your abdomen by using your fingers to remove them from your body. So how was it? If you have ever experienced any of these symptoms, you are probably constipated. Now, let's move on to how constipation occurs. Let me tell you the normal condition first. As food moves through our digestive tract, all of the nutrients are absorbed. The remaining waste moves from the small intestine to the large intestine, which is colon. Colon will absorb fluid from the waste and move it to the rectum, where it will be stored and expelled when there is an urge to defecate. Constipation can occur due to slow movement of the food through the digestive tract. This gives more time for the colon to absorb more water from the waste and dries out the stool. This makes it difficult to push it out of the body. You already know how constipation can occur. Let's now look at what can cause constipation. Firstly is when you do not take enough fiber and water. Constipation can occur when your diet is unbalanced, such as eating more processed foods, less fiber intake, and drinking less water. By taking more fiber, it can join with the stool, increase its weight and size, and then soften it. This will make it easier to pass through the rectum. Next, constipation can also occur if you frequently ignore the urge to go to the toilet. When you ignore the urge, you will eventually stop feeling it. This causes the stool to stay longer in the rectum, allowing more fluid to be absorbed. Constipation can occur if you do not exercise regularly. This is due to colon's response to physical activity. It is essential to have a good abdominal muscle tone in order to have a regular bowel movements. If the muscles are weak, they are not able to help in an easy defecation. Several medications, including aluminum antacid, which is used to treat indigestion, and opiate painkillers such as codeine, can cause constipation as their side effects. So, how to treat constipation? Well, you can do a lot to relieve constipation naturally at home. First and foremost, you should change your dietary habits. Consume more fiber-rich foods like vegetables, whole grains, nuts, and fresh fruits like bananas and papaya. To stay hydrated, drink at least 8 glasses of water per day. Besides, you can change your way of life. Exercise on a regular basis to improve your bowel function and to establish good toileting habits to empty the bowels at the same time every day. If the home remedies do not work, please seek help from a community pharmacist at any pharmacy near you. They will suggest some laxative for you to help relieve your constipation. As you can see, If you have constipation, you should treat it immediately. If not, long-term constipation can develop into serious complications. Do you want to know what happens if it is not treated? Let me tell you. Prolonged constipation can lead to the development of hemorrhoids, which are swollen veins in the anus. Pressure during bowel movement can cause swelling of the veins in your anus and lower rectum. Hemorrhoids can cause itching, pain, and swelling around the anus, as well as bleeding during bowel movements. And then, second condition that may happen is anal fissure, where skin around the anus is torn due to the pressure to have bowel movement and passing hard stool. The symptoms of anal fissure are a visible tear around the anus, pain during or after bowel movement, and bright red blood on toilet paper or stool after a bowel movement. You may also develop fecal infection where a hard mass of stool stuck in the colon, and rectal prolapse where the rectum fell from its normal position and may slip out of the anus. That's it! Seems like you have gained a lot of knowledge about constipation. Let's practice good diet and healthy lifestyle together to avoid constipation and have a wonderful day. Thank you for watching and goodbye. Stay safe and take care everyone.